Hello everyone, this is Dr. Sangeeta Chaudhary again, and once again I welcome everyone to my lecture class. In my today's class, I am going to discuss about certain technical points regarding insulin and certain technological advances in insulin in clinical practice. So in my previous class, I have already discussed about insulin, how does it function, what are the varieties of insulin, okay, the pharmacokinetics of insulin. So in this class, I will talk how you can storage insulin, what are the methods of injecting insulin, what are the sites where we inject, how do we inject, how do keep insulin from getting spoiled. Okay, so all these things I'm going to discuss with you in today's class. So let's begin with the insulin storage. Insulin is stable at a room temperature. Why it is very important to know about insulin storage and all the technical points? Because as a physician, as a practicing doctor, we need to advise our patients everything about insulin because they are the one who will be using or injecting insulin to themselves. It is the patient to whom or sometimes to the patient's relative we really need to describe everything about insulin, because if there is any mistake in insulin injection, if there is any mistake in insulin storage, then the efficacy will not be there and the blood sugar will not be controlled, and ultimately the patient will lose compliance with insulin. So this is very important that we know about insulin storage and injection techniques and everything, and then we convey all these messages to the person who is going to inject insulin. So insulin is stable at a room temperature. Insulin in use, it can be kept at room temperature for almost a month. So it is not necessary every time that insulin should be kept in fridge. It can be kept in room temperature. The vials, insulin vials can be kept at room temperature for almost a month. There is slight loss of potency if the same vial is used for more than 30 days. Extremes of temperature should be avoided and agitation, okay, with the vial should be avoided. And it should be kept away from heat, direct sunlight, or microwave. Okay, so this is the important things we need to know about insulin storage. Coming to the delivery methods of insulin, insulin can be delivered to a patient with the help of different, different technological advancements. There are different delivery methods of insulin. So, insulin syringe, which is the age-old method, okay, with the help of syringe, the insulin to be drawn from the insulin vial and it is to be injected subcutaneously. These days, we're very lucky that we have insulin pen, which are really easy to use, and the use of insulin pen is so compliant because patient becomes so compliant with this pen because they are almost painless. Okay, insulin pump. Okay, for type 1 diabetes patients who requires continuous infusion of insulin. So for this group of patients, insulin pump can be used. There is something known as a jet injector, which can also be used. There are inhalational forms of insulin, and there are buccal forms of insulin as well. So these are all about all about technology and technological advancements in the delivery of insulin in the modern era. Very importantly, insulin injection technique that should be known by the prescribing doctors, that should be known by the nursing staff, and it should be known, of course, by the patient because it is ultimately the patient who is going to inject himself or herself with the insulin. So, first of all, what now sites of insulin injection? Insulin has to be given subcutaneously, okay, and the sites of injection can be in the abdomen, it can be in the thigh, anterior or lateral aspect of the thigh, it can be in the gluteal region, or it can be in the dorsal area of the arm. So these are the sites of insulin injection. Okay, if someone is injecting insulin in the abdomen subcutaneously, then he or she should avoid a circle of 2 inches around the umbilicus. Skin should be gently pinched in between thumb and forefinger, okay, and the injection should be given at a perpendicular angle, okay. Skin should be pinched in between thumb and index finger, and then you can give the injection at a perpendicular angle. In thin people or children, it should be given at 45-degree, not 90-degree. That means not perpendicular, but it should be given at 45-degree angle. And there should be rotation of site within one area. Suppose someone is injecting in the abdomen, then someone should not inject every day at the same site. There should be rotation of the site. Okay. So this is a pictorial representation where we can see the sites of injection of insulin, that is just leaving behind a 2-inch circle in the abdomen. It can be given in the anterolateral aspects of the thighs. It can be given, okay. In the dorsal aspect of the arm, it can be given. In the gluteal region also, it can be given. Now the skin should be pinched in between index and thumb, and then the syringe should be inserted at a perpendicular angle, except in case of thin build and children, where it should be given at a 45-degree angle. There are disposable syringes which can be reused until it is blunt, because once it becomes blunt, it becomes very painful. It remains sterile up to 7 days if it is properly capped. Okay, if it is recapped and kept in refrigeration. Okay, if the disposable syringe is used and after using it is capped and it is kept in the fridge, then it can be refrigerated. Then it can be used for up to 7 days also, okay, and then it can be disposed of. So this is the technique as I was saying, okay. The area should be pinched and then enter the needle at perpendicular angle, okay. Then you need to push the insulin and wait for some time. Do not take out the syringe as soon as you push it. Push the insulin, then wait for a few seconds, and then you can take out the syringe. If we talk about the absorption of insulin, subcutaneous insulin absorption, it is, it is influenced by the site of injection. Okay, it is faster from the abdomen comparing to other side, and that is why it is advisable to begin insulin using at the abdomen. Okay, it is accelerated by increased in blood flow, local blood flow. Okay, that means after exercise or warming or local massage may result in increased absorption, because there will be increased in local blood flow, which will result in increased absorption. Okay, so these things should be avoided. Okay, after injecting insulin, exercise and massaging, these things should not be done. And the absorption is faster with smaller injection volume and lesser concentration. Okay. Okay. If the concentration is less, then the release will be faster. Okay. If the volume is less, then again the the release will be faster. Okay. This is about the absorption of insulin from the subcutaneous sites and the factors which can influence the absorption of insulin. Insulin pump therapy, as I said, insulin pump is something which will deliver insulin continuously, and it is based on physiological insulin release. That is phase 1 and phase 2 insulin release I have described in my previous class. So based on what body does naturally, the pump will do the same thing. It releases small amounts of insulin all the time. That is the basal insulin. That is the phase 2 of insulin release. Okay, and it also delivers extra doses to cover each meal or snacks. That is bolus insulin. That is the first phase of insulin release. So it covers the both first and second phase of insulin release. Rapid or short acting insulin. Okay, rapid or short acting insulin, they are the insulin which are used in insulin pump. Okay, they are very precise. The insulin pumps are very precise and they deliver insulin like micro drops. Okay, this is about insulin pump therapy. It is usually used in patients with type 1 diabetes mellitus. These are few examples of insulin pumps. You can see they are very portable. These days they have become more portable, so it is easy to carry along in the body. It will be attached with the body like this. Okay, this is the insulin pump. Okay, it will be attached like this. The dosage instruction will be entered in the machine. So dosage instructions are entered into the pump's small computer, and the appropriate amount of insulin which is to be injected into the patient will be calculated, and in a controlled manner it will be released. So this is about the insulin pump, which has become very handy these days, and it is really in use. So this much today. In my upcoming classes, I'll be talking about the insulin regimens, different insulin regimens, and how and when we need to give insulin to a particular patient. Thank you so much for attending this class.